So, Frank, could you just recapture very quickly how you got into this situation?
Certainly. I fortunately surfed the net and I looked for a clinic that could offer me stem cell treatment.
I was more talking about how you got your stroke. How it started.
First of all, I was working in Kuala Lumpur as a restaurant manager, and 5 months into my contract, the stroke hit. I was suffering, without my knowledge, hypertension quite high. So that resulted in the stroke, which was pretty soul-destroying for me. To have a very active, progressive life taken away from you was very hard. One of the things that hit me the hardest was depression, and it came down like a hammer. And I had psychological treatment to overcome this. Fortunately, I negated the use of strong drugs, which I didn't want anyway. So I got over that. So I had rehabilitation in the hospital in Kuala Lumpur for 1 month, and then I was allowed to transfer back to Australia, where I was in hospital for a further 2 months, one in the hospital and the second month in what they call a halfway house, which got me back into a situation where I started to work for myself. I was still confined to a wheelchair. And that's pretty hard when you've led a very active life to be confined to a wheelchair. It's not easy, but you have to do it. You have to do it. So I managed to progress from the wheelchair to able to walk with a cane. Not well, but I was determined that when I left the hospital I would walk out on the cane, and I did. But of course I was still confined to the wheelchair, outside of walking. Then I had continual rehabilitation in Canberra, but I wasn't happy. Unfortunately, the doctors in Australia, be it through a number of reasons, did not know about stem cell. Or if they did, they thought it was something that was science fiction. So it was never given to me as an option. I elected to go back to Vietnam, basically because I lived there for 17 years, so it was now my second home. So despite family influence, I went back. I continued my rehabilitation in Vietnam. I found some very good doctors, a very good acupuncturist, in fact 2 of them, and physiotherapy was continued. At that point, I decided to go surfing on the net. I thought there's got to be a better way. There must be a better way. And I was aware of stem cell. So I surfed the net and I came up with the Wu Stem Cell Clinic. I asked for information. Everything I asked for was given without any hesitation. I sent that information to my doctor in Australia. He also researched the clinic and came back and said, do it. Do it. So I did. We won't go into costs at this point because I don't think it's necessary. But suffice to say, I made that choice. I did. Nobody else. I did. So you can probably understand that on my arrival here at the clinic, there was a certain degree of apprehension. I wasn't sure what was going to happen, how it was going to happen, where it was coming from, how it was. I didn't know. So there was apprehension. That was dispelled in one day. Totally dispelled. Everything was made extremely categorically clear to me on what the treatment was, how it would be administered, and what would happen to me during the 5-week period. The only question I was asking was this wonderful thing called lumbar puncture. You have these wonderful things running through your mind of this thing about this long that's going to be driven into your spine like a jackhammer. It's not. I have heard tales, whilst I was here in the clinic, of patients who complained bitterly about the pain of the lumbar puncture. I can honestly say to you, if you can stand a pinprick That is the extent of the pain. You don't see, fortunately, a thing. You don't feel except a small pinprick. That's it. So you are administered with 5 million stem cells in the second week. The first week is total examination. There is not a test you don't have, believe you me. I was poked, prodded, blooded, ECG'd, ultrasounded, CT scanned. There was nothing in my body they did not know about, I'm here to tell you, which was very, very professional, extremely professional. So then comes week 1 and stem cell. Then you start to build in your own mind fear, apprehension. It starts to go, what are they going to do to me today? So by the time you get to the procedure room, and everyone's being very nice and very happy and they're smiling, they know what's going to happen, you don't. So I'm wheeled into the procedure room and I met 2 masked people, and good morning, hello, hello. So the fear is still sitting about here. And the next minute I'm rested on my side in a spine position. The doctor's realigning my spine. So that again the brain is going at 100 miles an hour. What's going to happen next? What's going to happen next? I felt a cool wash on my back. I felt a sterile cloth go onto my back. And then the doctor said to me, a little pain. The word was little, and that's exactly what it was. Little pain. And the procedure began. I find out later how it's done. The procedure of the mixing of the stem cells with spinal fluid and re-injecting takes a period of no more than 5 minutes. I would think 5, possibly 6. That's it. You lay down. You don't feel a thing. Then all of a sudden the doctor says, finish. Really? Where's the pain? Finished. And then you go back. If you have any degree of discomfort at all, what has to happen after the injection is that you lay perfectly flat for a period of between 4 to 6 hours to allow the stem cells to travel very comfortably up the spinal cord and to the area of the brain where they have to work. And that's it. So you sit back or lay back and you can watch movies, compliments of the DVD that you have. So about 2.5 movies later, you're up dancing. Well, not quite. And that's it. That's it. I have been able to achieve in the 5 weeks I've been here through intense physiotherapy, which happens 3 times a day, whether you like it or not, but you have beautiful physiotherapists who take care of you. So you have 2 courses of physiotherapy, one of occupational therapy and of course the stem cells. So by the time you leave the clinic, you are physiotherapy to occupational therapy to death, and you are 20 million stem cells richer. That 20 million stem cells to me has given me the ability to walk much better than when I arrived. I couldn't believe it. I do not use my cane. I don't. I walk everywhere. I walk slowly up and down stairs. The stem cells don't say, that's it, it's all over. They will continue to work, and the improvement will be incremental in the next month, the next month. So in 6, 8, maybe 9 months' time. Who knows? It depends on how they react to my body. I could have the greatest Christmas present under my mind.